Welcome to the celebration of the Doctor of Dental Medicine class of 2026. Please take your seats and silence your cell phones. If you would like the full digital version of today's program, please scan the QR code on the back of the printed copy. The ceremony will begin shortly. Thank you.
Please be seated. Good morning and welcome to the hooding ceremony for the Doctor of Dental Medicine class of 2026. I am Dr. Rachel Tomko-Novak, and I have the privilege of serving as the Associate Dean of Enrollment and Student Success at the College of Dental Medicine. To everyone in attendance, in person and streaming online, we're so pleased that you could join us this morning to celebrate the class of 2026. At this time, if you are able, I invite you to rise for the national anthem. Please be seated. It is my privilege to introduce the president of Roseman University of Health Sciences, Dr. Renee Kaufman, who will bring greetings on behalf of the university.
Good morning. On behalf of Roseman University of Health Sciences Administration and its Board of Trustees, let me be among the first to congratulate you, College of Dental Medicine Class of 2026. We are so pleased that you chose Roseman for your journey into dental medicine. We are thrilled that you have gotten to this point, and we look forward to all of the great things that you will do in your upcoming career as a dentist. Thank you and congratulations.
Thank you, Dr. Kaufman. We are grateful for your leadership and your support. Each person in attendance today is here to witness your transition from student to dentist. These individuals include members of our university, the College of Dental Medicine, and the profession. Each member of our audience is not only here as the role of friend, family, or mentor, but they also represent the public that you will serve throughout your career. I will now introduce the stage party. Please stand as I call your name and hold your applause until the end. Representing the university, President Dr. Renee Kaufman, Chancellor Dr. Jeremy Wells, and Vice President Dr. Jeffrey Talbot. Representing our Board of Trustees, John H. Rich. Our College of Dental Medicine Deans, Dr. Frank LeCarry, Dr. James Hupp, Dr. Jeremy Goddard, Dr. Joseph Cheever, Dr. John Fairbanks, Dr. Ryan Jones, Dr. Ryan Moffitt, and Dr. Paul Haft. Our College of Dental Medicine faculty, Dr. Allen, Bondi, Blackhurst, Bowman, Callahan, Cepeda, Cowden, Dang, Davis, Dickerson, Densley, Denoso, Emmons, Garlick, Heward, Hughes, Julian, McKinney, McMillan, Miller, Olpen, Pavlova, Quell, Rindlisbacher, Ribera Rowley, Sarvi, Sergakis, Simon, Slater, Smith, Valgardson, Whitelock, Amber Young and Shannon Young, and Porter. There are a lot of faculty here that love and care about each of you and really happy to celebrate with you. Our keynote speaker, Mr. Robert Befidi, Jr., President of Dexis at Invista Holdings, representing organized dentistry, Dr. Rodney Thornell, Utah Dental Association immediate past president, and representatives from the class of 2026, Dr. Adam Lawler, Dr. Caden Probert, Dr. Taylor Wynn, Dr. Noah Bailey, Dr. Andrea Falkowski, and Dr. Andre Soto. I would like to thank the stage party for all you do for our university, our college, and the public we serve, and for being here today to witness the presentation of the hoods, the pledge, and to celebrate with the class of 2026. Please be seated. Class of 2026. Everyone is excited to celebrate with you today. It has been an honor for each of us to be a part of your educational journey. The Roseman College of Dental Medicine class of 2026 has earned national recognition for its outstanding involvement in community service, student organizations, leadership roles, and college committees, with students serving at the local, regional, state, and national levels, and contributing to the success of countless programs, events, and initiatives through remarkable teamwork and collaboration. In addition to these leadership accomplishments, the class made a meaningful impact through participation in numerous community outreach and service events, including Give Kids a Smile, Head Start, Special Olympics, Veterans Appreciation events, and many others. Please join me in recognizing the exceptional accomplishments of the class of 2026. I now invite graduating student Dr. Andrea Falkowski to the podium to welcome all of you to today's ceremony.
Good morning, everyone, and welcome to the hooding ceremony for Roseman University's College of Dental Medicine class of 2026. When I was thinking about what to say today, I kept asking myself what becoming a doctor really means. 3 weeks ago, I found out in a way I had never expected. I was sitting on a flight back to Salt Lake City in seat 23C when the announcement came over the intercom. Ladies and gentlemen, if there is a doctor on board, please come to the front of the plane. We are experiencing a medical emergency. And for a moment, I froze. I remember walking down the aisle, almost hoping someone more qualified would step in front of me, but no one moved. And before I knew it, I was at the front of the plane saying, "Hi, I'm a dentist. I will help the best I can." A passenger had collapsed in the bathroom and was beginning to regain consciousness. He was confused, struggling to communicate, and clearly frightened. Suddenly, all I could think about was Dr. Miller teaching us about medical emergencies and the importance of staying calm under pressure. So we did what we were trained to do. We laid him down, we gave him oxygen, kept him calm, and worked together to get him safely through the flight. But what stayed with me the most about that experience was not the treatment itself. It was the realization that the moment I said, "I'm a dentist," people trusted me. Not because I had all the answers, and definitely not because I wasn't nervous, but because in that moment, someone needed help, and it was my responsibility to step forward. That experience changed the way I think about this profession. Because today is not just about earning a degree. It's about accepting responsibility. The responsibility to serve people in vulnerable moments, to stay calm when things feel uncertain, and to continue growing long after graduation. And I realized that response on that plane did not come from me alone. It came from the education, mentorship, and culture we were given here at Roseman. Over these past 3 years, this school has taught us far more than clinical skills. It taught us how to show up for people when they need us most. At Roseman, we began this journey with our 3 shared commitments: to treat each other as lifelong colleagues, to uphold integrity in everything we do, and to help each other become the best we can be. And while most of us may never respond to another emergency at 30,000 feet, people will place that same kind of trust in us every single day.
In dentistry, patients sit in our chairs during some of the most vulnerable moments of their lives. They trust us to relieve pain, restore confidence, improve function, and help them feel like themselves again. Sometimes that impact we make is obvious, but sometimes it's much quieter. It might be helping someone smile for the first time in years, or helping a patient feel comfortably, eat comfortably again after living in pain for so long. Sometimes the biggest thing we do is help people feel safe, understood, and cared for when they are embarrassed or afraid. And while those moments may not come with an announcement over the intercom, they matter just as much. Over the past 3 years, we studied together, struggled together, celebrated successes together, and learned from our failures together. And through all of it, we became more than classmates. We became lifelong colleagues. None of us reached this moment alone. To our faculty, mentors, families, friends, and loved ones, thank you for supporting us, challenging us, and helping us get to this moment. And to my classmates, thank you for the encouragement, resilience, and friendship you gave so freely over these past 3 years. A few days after the flight, the patient emailed me. He thanked me for helping him, but one sentence stayed with me. He wrote, "Thank you for, honestly, just being a cool human." And for some reason, that meant more to me than anything else. Because at the end of the day, beyond everything we accomplish, I hope that's what people remember about us. Not just that we became skilled clinicians, but that we became people others could trust in difficult moments. And when I look out at this class today, I can honestly say, I have no doubt that every one of you will be that kind of doctor. So wherever life takes us next, whether it's residency, private practice, public health, research, or maybe even seat 23C on a flight home, I hope we continue to step forward when people need us most. Congratulations, class of 2026. Thank you.
Thank you, Dr. Falkowski. I would now like to introduce you to our dean, Dr. Frank LeCarry. Dr. Frank LeCarry has been dean and professor of the Roseman University College of Dental Medicine since 2013. He has over 30 years of experience as an educator, administrator, and clinician. From 2019 through 2021, he simultaneously served as the interim chancellor of the Roseman University Utah campus. He previously served as an associate dean for academic affairs and professor at Midwestern University College of Dental Medicine in Downers Grove, Illinois, and has also held several leadership positions at the University of Illinois at Chicago College of Dentistry, Marquette University School of Dentistry, and the Commission on Dental Accreditation. He is an internationally known speaker, author, and consultant. Dr. LeCarry has worked with over 80 dental schools on curriculum development, student competency assessment, accreditation, and faculty development in the United States, Canada, Chile, Saudi Arabia, and the United Arab Emirates. He formerly served as the chair of the Joint Commission on National Dental Examinations and chair of the Commission on Dental Accreditation. Dr. LeCarry holds 3 advanced degrees from the University of Illinois at Chicago, including Doctor of Dental Surgery, Master of Public Health, and Master of Business Administration. He has been recognized with the International Association of Top Professionals as Top Academic Leader of the Decade, Utah Business Healthcare Hero Award for Innovation, UIC Distinguished Dental Alumnus Award, Pierre Fichow Certificate of Merit, American College of Dentists, and the International College of Dentists. I now invite Dr. LeCarry to the podium to introduce our keynote speaker.
Well, thank you. Mr. Robert Buffetti Jr. is a global senior executive with more than 25 years of leadership experience across healthcare, industrial, and technology-enabled sectors. He serves as president of Dexus at Invista Holdings, where he leads a portfolio of category-defining dental imaging and diagnostic technologies. including 2D and 3D X-ray, intraoral scanning, AI, cloud, IoT solutions that shape the future of digital dentistry. Mr. Bafidi has led multi-billion-dollar businesses and held the titles of CEO, President, General Partner, and senior leadership roles spanning strategy, marketing, mergers and acquisitions, private equity, digital transformation, and software engineering. He is known for inspiring global teams and driving turnaround transformation and growth across healthcare, medtech, industrial, and technology-driven markets. Prior to Invista, Mr. Bafidi held several senior executive roles at 3M. Earlier in his career, he worked in a private equity, consulting, investment banking, research, and software engineering roles. Mr. Bafidi holds an MBA with honors from the Wharton School, an MS in software engineering from the University of Minnesota, and a BS in computer science summa cum laude from Winona State University. Outside of work, he is an avid cook and a world traveler. Please join me in welcoming Mr. Robert Bafidi.
Dean LeCarry, thank you for that generous introduction. I have to adjust the mic a little bit. And for the invitation to share this momentous occasion with the Roseman University of Health Sciences College of Dental Medicine. Your leadership and commitment to building the next generation of dental professionals is evident in every graduate seated here today. This institution is fortunate to have you at its home. To President Kaufman and the board members in attendance, to the distinguished faculty and staff, to the mentors and clinicians who pour their expertise and their hearts into this institution and its students, thank you. What you do here extends far beyond the classroom. You are, in the most literal sense, shaping the future of dentistry. To the families, partners, and friends gathered here today, you are co-authors of this achievement. You absorbed the anxiety before exams. You provided meals during marathon study sessions. You offered patience when patience was in short supply. You believed even on the days when they may not have. This degree belongs to you as much as it belongs to them. And to the Roseman University of Health Sciences College of Dental Medicine, class of 2026. Good morning and congratulations. Today is yours. You have earned every element of it, every late night lab session, every moment of self-doubt that you refused to let stop you, every patient encounter that quietly tested your skills and your composure. You have been transformed by this journey, and yes, you now have logged more hours with your hands in the mouth of strangers than most people will in a lifetime. A testament to your extraordinary dedication and the preparation for this moment. Today is yours. Personally, it is a genuine honor to stand before nearly 100 graduates who are, as of today, stepping into one of the most trusted and consequential roles in all of healthcare. Dentistry is at once a precise science, a refined craft, and a deeply human service. What you are celebrating today is multifaceted. It is the acquisition of clinical knowledge, as well as the formation of character, judgment, and professional identity. I come to this moment from a particular vantage point. I grew up in a family of clinicians. As a child at our family dining table, in addition to casual conversations about friends, family, school, and sports, I was often unknowingly immersed in a seminar in clinical outcomes, in ethics, and in the weight of responsibility that comes with caring for another human being. From a very early age, I understood that working in healthcare was not merely a career, it was a calling. As a pediatrician, my father took care of other people's kids. One of those cases that stayed with me over the years was when he took care of conjoined twins. For weeks, it was all my parents talked about. To this day, I still have vivid memories of moments in hospitals and at home about that time. I can still picture those babies, feel the care that my father had for them. I can still smell what the day felt like. That calling ultimately led me into the ecosystem that surrounds and enables clinical work. Personally, too many hours and days and weeks spent waiting for my parents in hospital halls and offices kept me from aspiring to myself being a clinician. Today, I lead a medical technology company focused exclusively on dentistry, which means the instruments in your hands, the imaging systems guiding your diagnosis, the materials you will use to protect, to restore, or to transform the patient's oral health are the very things my colleague and I work on every single day. Broadly speaking, I've spent my career in healthcare, including medical technology, life sciences, medical devices, and dentistry, thinking about one question: how do we give clinicians the tool they need to deliver the care that is more precise, more predictable, and more patient-centered to improve clinical outcomes? So when I look at you today, I do not just see the next generation of dental professionals. I see the people we innovate for, the people we build for, the partners we work with. You and your future patients are the reasons why my work matters. I want to offer you 3 principles on your graduation day. Think of them as convictions drawn from years of experience spent at the intersection of clinical practice and the technologies that enable it. The first principle is this: your instruments are an extension of your hands, and your hands are an extension of your values. Choose accordingly. In my work, I've had the privilege of watching gifted clinicians in research facilities, in teaching hospitals, in private practices, and in health centers. And I can tell you that the best among them share a trait that has nothing to do with clinical acumen alone. They are intentional. They are intentional about the protocols they follow, the tools they select, about the standards they set for themselves and for their teams. Quality is a professional commitment. Patients cannot read dental x-rays. They cannot evaluate your preparation margins or critique your composite laying technique. But they feel the difference in how they heal, how they function, and how they experience the care under your hands. When you invest in excellence, in materials, in technology, in your own continuing education, you are making a statement about what your patients deserve. Make that statement loudly and make it every single day. The second principle is this: excellence is not an event. It is a disciplined practice in the ordinary moments when no one is watching. In dental medicine, the true separator between adequate care and exceptional care is not found in the grand gestures. It's found in the diagnostic rigor you bring to the routine examination, in the exam treatment plan you agonize over because you want to get it exactly right, in the second opinion you seek because the case deserves more than your first instinct. It is found in the habit of asking for every patient who sits in your chair, not what can I do, but what should I do. Your legacy as a clinician will not be defined by the volume of patients in your practice or the revenue you generate. It will be defined by the accumulation of those individual decisions made thoughtfully, made honestly, made in service of the person across from you. That is the architecture of a legendary career. The third principle is perhaps the most enduring. Your reputation is the compound interest of every choice you make when no one is holding you accountable but yourself. There is a saying in dentistry that I find both humbling and clarifying. When I do good, no one seems to remember. When I do bad, no one seems to forget. I would submit to you that this is a privilege in disguise. It means the standard is clear, it means integrity is not optional, and it means that every restoration you make, every crown you place, every extraction you perform, every patient interaction you conduct is an act of authorship. You are writing your professional story one procedure at a time. Trust in healthcare is the medium through which all healing occurs. Protect yours with the same precision you bring to your clinical work. As I prepare to close my remarks, I want to speak to something that no accreditation standard can fully measure and no board examination can fully test. And yet, it may be the single most powerful clinical skill you possess. Patients will come to you in many cases at the edge of their comfort. Dental anxiety is among the most pervasive in all of medicine. Speaking from personal experience, patients will sit in your chair having postponed their appointment for months, perhaps years, out of fear. They will be in pain or embarrassed or bracing for a diagnosis they're afraid to hear. They will be vulnerable in ways that we may not have words for. In those moments, they will come, and often your most essential instrument is not going to be your tray. It's going to be in the quality of your presence, the steadiness of your voice, the way you make a person feel seen before you begin any procedure. The greatest clinicians I've encountered in the industry understand something profoundly. Beyond treating a tooth, they are treating a person who happens to have a problem with a tooth. That distinction, lived out consistently, is what perhaps separates the technically proficient from the truly exceptional. Listen before you look, explain before you act, reassure not just clinically, but humanly. Class of 2026, you're entering a profession that is changing faster than at any point in its history. Artificial intelligence is reshaping diagnostics. Digital workflows are transforming the way we plan and deliver treatment, and new materials are redefining what restorations can achieve. The practice you build over the next decade will look different from anything that came before it. However, here's what I know with certainty from my years in healthcare. Technology will continue to evolve, and the most important things will remain constant. Patients will always need someone they trust. They will always need the clinician who shows up for them fully, with skill, with honesty, and with care. No algorithm will replace that. No device will replicate it. That is yours, and it is irreplaceable. So as you leave this ceremony and step across the threshold in your professional lives, I want to ask you to carry three things with you. The commitment to excellence that got you here, the integrity to hold that standard even when no one is watching, and the compassion to remember that behind every chart, every case number, every 2D or 3D dental x-ray, there is a human being who chose to trust you. Honor that trust every single time. You will restore smiles. You will relieve pain. You will build the confidence that allows someone to laugh freely, to speak without self-consciousness, to feel whole. You will do these things over and over again, and often without recognition and without fanfare. And it will matter profoundly. Go change the world, one patient at a time, one decision at a time, one act of excellence at a time. Congratulations, class of 2026. The profession is ready for you. I cannot wait to see what you do.
Thank you, Ms. Graffiti, for that wonderful address. On behalf of the class of 2026, and deep appreciation for you being here today, we have a lovely memento for you to put in your office remembering this occasion.
Thank you so much.
Thank you.
Appreciate it.
Thank you.
Thank you, Mr. Bafidi. We appreciate all that you have done for the field of dentistry. We're now ready to begin the hooding portion of this ceremony. President Kaufman will join Dean LeCarey and Chancellor Wells and Mr. Bafidi over by the flags to take pictures and congratulate our newest doctors of dental medicine on their achievement. I request that the first row of the class of 2026 please stand, and those who have been asked to hood those in the front row, please start moving towards the stage entrance. As a reminder, there's a QR code on the program you all received on the back side that you can click on to see the full program that includes everyone's photos and the names of everybody, so you can look there. I invite Ms. Alicia Badley, Director of Enrollment and Student Success, and Mr. Jonathan Mack, Assistant Dean of Enrollment and Student Success, to the other podium to read names of the members of the class of 2026 as they receive their hoods.
Dr. Hassan Mahmoud Aboud. Hassan will be working at Dental Dreams in Detroit, Michigan.
Dr. Colin Adamson. After graduation, Colin will be going into private practice to work with his father in Utah.
Dr. Kiran Ahmed. Kiran will be working at a private practice in Northern California.
Dr. Umaira Ahmed. Umaira will be joining Pacific Dental Service in Houston, Texas.
Dr. Spencer Allen. Spencer will be working at West Richland Family Dental in Richland, Washington.
Dr. Ian Altabelli. After graduation, Ian will be joining a dental service organization in Vail, Arizona.
Dr. Rama El-Zuhaili. Rama will be working at PDS office in Dallas, Texas.
Dr. Sue Amorn-Senarak. Sue will be joining Dentists of Arvada in Arvada, Colorado.
Dr. John Richard Anderson. John will be working at Delaney Park Dental in Anchorage, Alaska.
Dr. Jacob Lyman Andrew. After graduation, Jacob will be joining Comfort Dental in Oklahoma City, Oklahoma.
Dr. Urwa Assad. Irwa will be working at a private practice in Dallas, Texas.
Dr. Amritpal Badwals, who is not in attendance today, Amritpal will be completing a periodontics residency at Marquette University.
Dr. Noah Levan Bailey. Noah will be joining Aesthetic Family Dental Care in Mesa, Arizona.
Dr. Peyton Bailey. After graduation, Peyton will be working at Duncan Dental and Implants in Duncan, Oklahoma.
Dr. Suchita Bandarupalli. Suchita will be joining Heartland Dental in Tampa, Florida.
Dr. Amisha Bardwaj. Amisha will be joining her father's private practice in Dallas, Texas.
Dr. Aaron Braggington. Aaron will be working at a private practice in Lebanon, Oregon.
Dr. Paul Campbell. After graduation, Paul will be joining Comfort Dental.
Dr. Mark Conrad. Mark will be completing an oral and maxillofacial surgery residency with the U.S. Army at Fort Lewis, Washington.
Dr. Sammy David. Sam will be working in general practice in Chicago, Illinois.
Dr. Aditya Deshpande. Aditya will be completing a residency at the University of Pennsylvania in Philadelphia.
Dr. Gabriel Eisenhuth. After graduation, Gabriel will be completing an orthodontic residency.
Dr. Andrea Falkowski. Andrea will be completing a prosthodontics residency at the University of Buffalo.
Dr. Elena Ferris. Elena will be completing a NYU Langone pediatric residency in Columbia, Missouri.
Dr. Parker Folsom. Parker will be completing an oral and maxillofacial surgery residency at the University of Florida.
Dr. Hallie Gable. After graduation, Hallie will be joining PDS Health in Denver, Colorado.
Dr. Jacob Gardner. Jacob will be completing a residency at the Georgia School of Orthodontics.
Dr. Isabella Gaxiola. Isabella will be joining iSmile.
Dr. Garrett Ray Geiger. Garrett will be joining a private practice in Arizona.
Dr. Brenda Giffen. After graduation, Brenda will be working at PDS Health in Denver, Colorado.
Dr. Jasmine Gill Gurm. Jasmine will be attending an advanced education in general dentistry program in Pennsylvania.
Dr. Justina Gorgi. Justina will be completing an orthodontics preceptorship at UCLA.
Dr. Josh Havlick. Josh will be joining a private practice in Hawaii.
Dr. Miyoshi Hicks. After graduation, Miyoshi will be working at Presbyterian Healthcare Services in New Mexico.
Dr. Tao Ho. Tao will be joining PDS in Los Angeles, California.
Dr. Cynthia Elizabeth Huang. Cynthia will be completing a pediatric dental residency at the University of Rochester.
Dr. Michael Huang. Michael will be working at Pacific Dental Services.
Dr. Susanna Huang. Susanna will be completing an advanced education in general dentistry residency at the VA San Antonio in Texas.
Dr. Sarah Jaffer. After graduation, Sarah will be joining a private practice in West Virginia.
Dr. Kyle Jensen. Kyle will be working at Comfort Dental in Kansas City, Missouri.
Dr. Brigham Jukes. Brigham will be completing an advanced education in general dentistry with the U.S. Air Force at Joint Base Andrews in Washington, D.C.
Dr. Michael Kane. Michael will be joining Dental 360 in Chicago, Illinois.
Dr. Song Wong Kong. After graduation, Song Wong will be completing an advanced education in general dentistry residency at Fort Campbell, Kentucky.
Dr. Laura Karitza. Laura will be working at Bothell Modern Dentistry in Bothell, Washington.
Dr. Randy Kwan. Randy will be joining a private practice in Tooele, Utah.
Dr. Kelsey LeBang. Kelsey will be working at a dental service organization in Houston, Texas.
Dr. Jennifer Lacayo. Jennifer will be joining Liberty Commons Family Dental in Cincinnati, Ohio.
Dr. Adam Lawler. After graduation, Adam will be completing a NYU Langone pediatric residency in Providence, Rhode Island.
Dr. Trang T. Huang Lei. Tina will be completing an NYU Langone Advanced Education in General Dentistry residency at Roseman University.
Dr. Marcella Cecilia Leakehe Farley. Marcella will be completing an advanced education in general dentistry residency at the University of New Mexico.
Dr. Christine Lee. Christine will be completing a pediatric residency.
Dr. Dylan Hatcher Lee. After graduation, Dylan will be completing a pediatric residency at Boston University.
Dr. Samantha Lee. Samantha will be completing a general practice residency at the University of Michigan.
Dr. Ida Carolina Lepe. Ida will be completing a dental anesthesiology residency at Advocate, Illinois Masonic Medical Center.
Dr. Osniv Lebarian. Osniv will be completing an NYU Langone Advanced Education in General Dentistry residency at Roseman University.
Dr. Samuel Gunton Lofquist, who is not in attendance today. After graduation, Sam will be starting biological dentistry of Southern California.
Dr. Martha Lopez Munoz. Martha will be working in Los Angeles, California.
Dr. Johanna Liu. Johanna will be completing a pediatric dental residency at the University of Rochester.
Dr. Natasha Shafiq Malik. Natasha will be joining Dental 360 and Associates in Illinois.
Dr. Kayla Matheson. After graduation, Kayla will be working at Integrated Dental Arts in Spokane, Washington.
Dr. John Joseph McKerney III. John will be completing a non-categorical oral surgery residency at the University of Arizona.
Dr. Shania Meshnig Giordano. Shania will be working at Lumio Dental in Lawrence, Kansas.
Dr. Benjamin Alexander Manel. Benjamin will be joining Aspen Dental in Stillwater, Minnesota.
Dr. Parker Morris. After graduation, Parker will be completing a residency with the U.S. Army at Fort Campbell, Kentucky.
Dr. Bart Kendall Morrison. Kendall will be completing a residency at Tufts University in Boston, Massachusetts.
Dr. Lynn Muhafel. Lynn will be completing a NYU Langone Advanced Education and General Dentistry residency at Roseman University.
Dr. Tiffany Nelson. Tiffany will be completing an advanced education in general dentistry residency with the U.S. Air Force in Eglin, Florida.
Dr. Mintao Win Sperry. After graduation, Mintao will be joining Clinton Dental Group and Orthodontics in Clinton, Utah.
Dr. Taylor Min Khan Nguyen. Taylor will be completing an oral and maxillofacial surgery internship at UT Health Houston Medical Center.
Dr. Stephen Osman. Stephen will be working at a private practice in Utah.
Dr. Tara Isabella Othman. Tara will be completing an advanced education in general dentistry residency with the U.S. Army at Fort Campbell, Kentucky.
Dr. Ishan Patel. After graduation, Ishan will be joining PDS in Corona, California.
Dr. Pino Apurva Patel. Pino will be pursuing an opportunity with PDS in Virginia.
Dr. Shiv Patel. Shiv will be returning to Georgia to practice in general dentistry.
Dr. Tommy Paulson. After graduation, Tommy will be working at BPK Dental in West Valley, Utah.
Dr. Lauren Grace Peabody McFarland. Lauren will be joining Peter Christensen Dental Clinic in Minocqua, Wisconsin.
Dr. Caden Probert. Caden will be completing an orthodontics residency at Southern Illinois University.
Dr. Zainab Kuzelbash. Zainab will be joining PDS in Arizona.
Dr. Nuha Ahmed Razidin. After graduation, Nuha will be working at Smile Fresh Dental in Auburn Hills, Michigan.
Dr. Luke Chandler Rockwood. Luke will be joining Comfort Dental in Colorado.
Dr. Sonia Mary Sabu. Sonia will be completing an oral and maxillofacial surgery residency at Geisinger Health in Wilkes-Barre, Pennsylvania.
Dr. Catherine Sanders. Catherine will be working at Grimes Dentistry in Lubbock, Texas.
Dr. Namat Sardar. After graduation, Namat will be joining Lumio Dental.
Dr. Sierra Madison Sibley. Sierra will be joining the PDS Owner Doctor Development Center in San Dimas, California.
Dr. Seth Archie Smith. Seth will be completing a periodontal residency at Oklahoma University.
Dr. Spencer Smith. Spencer will be completing an orthodontics residency at the Georgia School of Orthodontics.
Dr. Andres Soto. After graduation, Andy will be completing a residency with the United States Navy at Great Lakes in Chicago, Illinois.
Dr. Emily Stutz. Emily will be working at Young Family Dental in Utah.
Dr. Brian Matthew Tack. Brian will be completing the 2-year advanced education in general dentistry residency at Fort Cavazos.
Dr. Lawrence Tran. Lawrence will be joining a private practice in Los Gatos, California.
Dr. Roshni Trivedi. After graduation, Roshni will be completing a dental anesthesiology residency at Jacobi Medical Center in Bronx, New York.
Dr. Catherine Vela. Catherine will be joining Platinum Dental in Salt Lake City, Utah.
Dr. Dao Vo. Dao will be working at Cal Dental USA in Riverside, California.
Dr. Abigail Warner. Abigail will be completing an orthodontic residency at the University of Buffalo in New York.
Dr. Kyle Wright. After graduation, Kyle will be joining Down East Dental in Ellsworth, Maine.
Dr. Hattie Young. Hattie will be working at a private practice.
Dr. Gore A. Zalian. Gore will be joining a private practice.
Dr. Yasmin Khaled Zamel. Yasmin will be working at a DSO practice and as an associate dentist.
Dr. Jason Randy Zarge. Jason will be joining PDS in Colorado. Please join us in congratulating our newest doctors of dental medicine.
I now invite Dr. Jeremy Goddard, Associate Dean for Clinical Affairs and Patient Care, to come to the podium to lead the students in the Dentist Pledge.
Congratulations on receiving your doctoral hoods. I would like to remind all in attendance that the Dentist Pledge is shown on your program. As we take this pledge, look around to those who gather with you, your friends, lifelong colleagues, and family. They and every patient you will see are the people to whom you are making this pledge. This is your commitment. As a reminder, when you see state your name, please state your own name. Graduating members of the class of 2026 and all dentists present, please arise. Raise your right hand, square your arm, and recite the Dentist Pledge with me. I, Jeremy Goddard, as a member of the dental profession, will keep this pledge and these stipulations. I understand and accept that my primary responsibility is to my patients, and I shall dedicate myself to render to the best of my ability the highest standard of oral health care and to maintain a relationship of respect and confidence. Therefore, let all come to me safe in the knowledge that their total health and well-being are my first considerations. I shall accept the responsibility that, as a professional, my competence rests on continuing the attainment of knowledge and skill in the arts and sciences of dentistry. I acknowledge my obligation to support and sustain the honor and integrity of the profession, and to conduct myself in all endeavors such that I shall merit the respect of patients, colleagues, and my community. I further commit myself to the betterment of my community for the benefit of all society. I shall faithfully observe the principles of ethics and code of professional conduct set forth by the profession. All this I pledge with pride in my commitment to the profession and the public which it serves. Congratulations. I congratulate each of you for publicly affirming your professional responsibilities through the pledge. I now invite Dr. Joseph Cheever, Assistant Dean for Clinical Research, to the podium to lead the commissioning of graduates entering the military and to recognize our Health Services Scholarship recipients. Dr. Cheever.
You look awesome, by the way. You new doctors, I'm proud of you. Serving our country as a member of the armed forces or the public health service is a great honor. Roseman University has had historically a high number of students on military and public health scholarships. At the conclusion of their dental program, those on military scholarships are inducted into one of the uniformed services, the Navy, Army, or Air Force. As a retired Army Reserve dental officer, it's my honor to lead the commissioning ceremony, and I invite the following to stand up beside me on either side. Dr. James Hupp, Captain, retired United States Navy. Dr. Dwayne Callahan, Captain, United States Army. Dr. Paul Haft, Captain, United States Army. Dr. David Julian, retired Colonel, United States Army. Dr. Pete Emmons, Lieutenant Colonel, United States Army. And Dr. Shannon Young, Major, United States Army. As is customary with this tradition dating back over 200 years, all officers of the Uniformed Services of the United States swear or affirm an oath of office upon accepting their commission. I now ask the officers being commissioned today to come to attention as I call your name and remain standing for the oath. Air Force, Brigham Jukes. Air Force, Tiffany Nelson. Navy, Andres Soto. Army, Mark Conrad. Army, Sang Wan King. Army, Parker Morris. Army, Tara Isabella Othman. Army, Brian Matthew Tack. Before I administer the oath, I invite all active duty and reserve and retired members of the uniformed services from our faculty and the audience to please stand at attention at your seats and witness the oath being administered. To those now standing, thank you for your service to our country. I will now administer the officer's oath of office. To those taking the oath, please raise your right hand, square your arm, and repeat after me. I state your name. Do solemnly swear or affirm that I will support and defend the Constitution of the United States against all enemies, foreign and domestic. That I will bear true faith and allegiance to the same. That I take this obligation freely, without any mental reservation or purpose of evasion. That I will well and faithfully discharge the duties of the office on which I'm about to enter. So help me God. Congratulations to our new military dentists. In addition to our military officers, one of our graduating students will serve the country as part of the National Health Service Corps. These public health dentists provide wonderful service to the many vulnerable populations that live in our country. I ask that Miyoshi Hicks stand to be recognized by all assembled. Please be seated. Thank you, thank you. I now invite the class of 2026 speaker, Dr. Andy Soto, to the podium to provide a perspective on the class of 2026's journey, past, present, and future. He's also wearing his navy whites.
Distinguished faculty, honored guests, family and friends, and my fellow graduates of the class of 2026. I'll be honest with you, I have rewritten this speech more times than I prepped to Class 2 cavity, because all of my earlier attempts, frankly, were awful. Apparently, thank God it's finally over, is not considered a complete speech. And every time I wrote something like "this journey has been transformative," I wanted to leave the room myself. So what you're left with is what follows. Not long ago, every single one of us was just an applicant, grinding daily through DAT prep, polishing personal statements, shadowing dentists, and rehearsing interview answers that may or may not have included something like, "Ever since I was a child, I knew dentistry was my calling," or the bold classic, "I just love teeth." Nobody believed either of those, by the way, including us. We built resumes, we volunteered for pretty much anything, retook exams when we had to, and kept going. Then at some point, an email arrived that said Roseman wanted us. That was the moment everything we had been working for finally paid off, and the moment the real work began. Right from that very first day, Roseman handed us a concept to grow into the lifelong colleague. It sounded nice, maybe a little idealistic, but 3 years have a way of proving things. We actually became exactly that. We created bonds that will surely last this lifetime, not because anyone forced us to, but because this program puts you in situations where leaning on the person next to you is not optional. It is survival. And it turns out that survival is a surprisingly good foundation for friendship. For our class, survival meant something extra. We were Roseman's first 3-year cohort, the guinea pigs, the ones navigating a program still finding its own footing. And somehow, that just made us closer. Late nights before licensing exams, group texts at midnight trying to figure out why the margins weren't right. Someone always had the notes, the answer, or at least the willingness to stay up and try to figure it out together. That is the culture this place built in us. And honestly, I do not think any of us fully appreciated it while it was happening. Then came SimLab. Sitting in the same position for 2.5 hours, working on a plastic tooth, doing everything you know how to do. And then a faculty member walks up, looks down at your prep, says absolutely nothing, and then walks away. Right? If you have been through that moment, you know exactly what that silence is communicating. It is not cruelty. It is an honest assessment. It is the gap between where you are and where you need to be. Those moments were not meant to break us. They were meant to teach us something important, that discomfort is information, not condemnation. That mastery is not given to you. It is extracted from you through repetition, through failure, and through showing up anyway. Every single one of us sitting in this room today learned that lesson. Then came clinic. Real patience, real responsibility, real stakes. And that, for me at least, is when things stopped being abstract and got very, very real. Not just because the work, I remember the first time a patient looked into a mirror after treatment and their face changed. Not just because the work was done, though we certainly aimed for precision, but because they saw themselves differently. They smiled. Not the polite smile people give when they're trying to be nice, the authentic kind. The kind that comes from somewhere much deeper than dental work. A moment like that is the moment you realize this was never really about teeth. It is about giving someone back a piece of themselves they have quietly learned to live without. Their confidence at a dinner table, their ability to laugh without covering their mouth, their comfort just getting through a day without pain. We did that, and it is worth every single thing this program put us through. But let us remember, none of us got here alone. To our faculty, thank you. Not just for the knowledge, but for the standards you refused to lower, the ones we resented in the moment and are deeply grateful for now. You did not just teach us technique, You taught us how to think under pressure, how to stay calm when a patient is scared, and how to lead with integrity even on the hardest days. You believed in our potential before we believed in it ourselves. To the dental assistants, hygienists, and support staff, you're the absolute backbone of everything we learned to do. You showed up every single day, often without enough recognition, and you guided us more than you probably know. We saw it, we felt it, and we thank you wholeheartedly. And to our families and loved ones, you watched us disappear into textbooks for months at a time. You took the late phone calls when the pressure was on. You listened to us doubt ourselves and refuse to agree. You made sacrifices that we may never fully be able to repay. So we hope you know this degree belongs to you too. Every moment of support, every meal left on a counter, every "you've got this" when we did not quite believe it ourselves, all of that is celebrated in this room today. This moment is as much yours as it is ours. Class of 2026, here's what I want to leave with you today. We chose a profession that asks us to be with people at their most vulnerable. Most patients are nervous before they even sit down. They carry through our door years of anxiety, bad experiences, and sometimes just plain dread. And every single day, we have the chance to change that. To be the person who took the time to explain what was happening, the person who treated them with patience and dignity, the person who made them feel safe enough to come back. That is no small thing. That is everything. The title of doctor is something to be proud of, but it is not the point. The person is the point. Their trust is the point. And the kind of professional you choose to be in the quiet moments, when no one is watching or grading you, that is the point at where your true character lies. It is what defines us as Roseman alumni. It is what unites us as lifelong colleagues. Class of 2026, we made it. Congratulations. Let me get some. Yeah. Yes. Oh, yeah. We did it. We endured 3 years of everything this program threw at us, and we not only survived, we're sitting here smiling today. That can only mean one thing. We really do love teeth. Thank you.
Thank you, Dr. Andres Soto, for your perspective on the journey completed by the class of 2026 and the journey yet to come. To our newest doctors of dental medicine, thank you. Thank you for the way you've lifted one another up and for the colleagues and friend you will be to each other for the rest of your lives. As you go, hold on to one simple thing. Care for every person who sits in your chair with compassion, with honesty, and with the best science you have. Do that, and you will not only build a successful career, you will bring together the heart and science of healthcare. And that is what makes this profession so deeply worth being a member of. Remember, as you step into this next chapter of your lives and you join a remarkable family of Roseman alumni, men and women now caring for patients across nearly every U.S. state, throughout Canada, and in countries around the world. Wherever you go from here, you carry your DMD program with you, and you will make its name known far beyond these walls. To every family member, friend, and mentor here today, thank you for making this such a meaningful celebration for the class of 2026. None of these graduates arrived at this stage alone, and this day belongs to you as much as to them. My friends, we've reached the conclusion of today's ceremony. Family and friends, please remain seated until the stage party, faculty, and graduates have left the theater. They will be waiting in the lobby, ready to celebrate this moment with you. Once again, congratulations to our newest doctors of dental medicine. We could not be prouder of you. Thank you.